Thank you so much for joining us this morning for the Health, which is the third installment of our ongoing conversation on race and food allergy. My name is Karen Palmer. I'm a certified professional coach and a food allergy advocate, and I'm very happy to welcome you here today. I'd first like to take a moment to thank all of the staff at Food Equality Initiative for their very hard work on this webinar series. It takes a tremendous amount of coordination to put events like this together, and I know how much we all appreciate their efforts. So before we get started, I'd like to let you know that this webinar is being recorded and that all participants are muted in order to prevent any unwelcome distractions, the kind of which we've gotten very used to in the days of Zoom. The team at Food Equality Initiative will send links to the resources we share from this webinar to everybody who has registered after the event. Please feel free to use the chat function to share any questions that you'd like to ask our panel members. And we will have time for Q&A later in the program, so please, jot yourself some notes along the way so that you don't forget any of the things that you might like to throw into the hat. So as always, we have a lot to cover in the next hour. Some of the things that we would like to touch on are the issue of how institutions and systems serve families with food allergies. How does that need to change in order to eliminate racial and economic disparities and to provide better outcomes for folks with food allergy? What kind of ideas might be offered in terms of how to better integrate medical care and social supports for food allergy patients, and recognizing and leveraging the economic power of food allergy aware consumers. Now I'd like to introduce our panelists. Dr. Bridgette Jones, the Associate Professor of Pediatrics, Division of Allergy, Asthma, and Pharmacology at Children's Mercy Hospital in Kansas City, Missouri. Nicole Ledoux, co-founder and CEO of 88 Acres Foods, a leading allergy-friendly brand working to expand healthy food options for school children. Jerry Jones, Director of Community Health at Blue Cross Blue Shield of Kansas City, a leader in integrating the social determinants of health into healthcare service delivery. Lisa Gable, CEO of Food Allergy Research and Education, known to many as F.A.R.E, an advocacy organization working to improve the lives of people with food allergies. And finally, Emily Brown, founder and CEO of the Food Equality Initiative, whose call for community action brings us together today. So today's conversation will center on how community-based and national institutions and systems have contributed to the difficulties around racial and economic disparities in food allergy, and what changes can be made to improve access and care for all. Emily, when we first started talking about the idea of institutional change, you brought up a concept that was actually new to me, the idea of, quote, food as medicine in the treatment of food allergy. Can you tell me a little bit about what that means?
Yes, Karen. Food allergies, in its very name, is centered around food. And so for so long, the prevailing treatment for food allergy has been food avoidance, meaning really having access to the right foods at the right time is critical in the management of the disease. And so when food avoidance is the standard of care or prevailing treatment, then access to food really is not just a matter of sustenance, it is really more a matter of treatment. It is how families manage the condition. And this theory or this practice of food as medicine is really, really born out of the idea that food, we know, is a building block for good health, and good nutrition is key to maintaining health and wellness. And so the idea of food in the treatment as a form of treatment is relatively new, but really has always been a part of how we manage the disease. Again, having the right food at the right time, understanding cross-contamination and how to avoid that, but really making sure that patients can manage and have the food that they need to not only substitute the allergens that they may be avoiding, but also making sure that they have access to the resources to replace nutrition that may be lost, particularly during important development stages.
So how well is this concept actually understood and embraced by folks within, the healthcare and, the advocacy communities?
I'd say it's one that's really taking off. It's really more been centered around what is traditionally known as diet-related illness. So things like diabetes, heart disease, end-stage renal care, really looking at the role that diet plays in driving the development of those diseases, and then really looking at food as medicine as a form of prevention and a form to help manage those conditions. And so I feel like there's been really over the last 10 years, a lot of efforts and strides in making sure that those patients have access to the things that they need. And, you know, our work at Food Equality Initiative has always been centered around health equity and looking at kind of the impact and taking that food as medicine lens to what we call diet treated illnesses. So illnesses that are not driven or caused by poor diet, but illnesses that are primarily managed by, you know, the foods that they eat or have access to. So things like food allergy and eosinophilic esophagitis, celiac disease even, where, you know, avoiding gluten is the only treatment.
This is actually, this is a big conversation, so I want to be able to jump back into this later on in the back half of the program when we can talk a little bit more expansively about it. But I understand that you also have some news to share about Food Equality Initiative and the work that you're doing this morning. So please, we'd love to hear it.
Yeah, I know that we've kind of been teasing an announcement, and I just want to share a statement that, you know, is going to be published on our website today. But it just really talks about the evolution of who we are. You know, obviously, when I started Food Equality Initiative 6 years ago, it was really an effort to improve the quality of life, not only for my family, but for my community. You know, I'm really proud of the work that we've accomplished together with our partners to provide direct services to families who are experiencing food insecurity and food allergies. Again, at our core, health equity, we have a commitment to health equity and finding a solution to a critical challenge in the management of food allergies and celiac disease, and that is access to safe and healthy foods. And while new treatments are emerging, and we're excited about those new treatments in the pipeline, the prevailing standard of care continues to be food avoidance. And again, access to food is not only a matter of sustenance. In that case, it is a matter of treatment. That is why I'm proud to announce our bold commitment to supporting all patients with food allergies and celiac disease so that they have access to the safe foods that they need to manage their health and wellness. So the announcement is that we are not a pantry. Much of our identity for the first 5 years of our existence has been tied to the way that we have delivered services. Yes, we have distributed food through pantries. However, we have always been so much more. We focus on food policy beyond the food label. We are a national leader in the food as medicine movement. And together with our partners, we are building a future where all patients have consistent access to the foods they need to adhere to their prescribed diets. Our humble beginnings in the pantry have only reinforced our belief that when we rise above the status quo and take care of the least among us, everyone wins. So the announcement is we're not a pantry, and that our work definitely supports the least among us, but really it has an impact for everyone that is living and managing and impacted by food allergies and celiac disease. And ultimately, our goal is to make sure that all patients have access to those resources.
That's an amazing announcement. I know that that is something that will be really just joyfully embraced by the rest of the food community in general, not just the food allergy community. I think we discussed the fact that, the New York Times just last week did a cover story on the issue of hunger and food insecurity across the nation. And these problems have been here with us for a long time. The pandemic exposed them in a very real and raw way. And so what you have to bring to this conversation will be gratefully embraced, I think, by many people who have a lot to learn about the scope and the depth of the problem. So again, we'll be touching more on that in the back half of our discussion, but thank you for everything that you and Food Equality Initiative are doing to serve, all people who are food insecure. I'd love to turn to you, Lisa, and just dig in. One of the things that FARE has done, I mean, obviously FARE is known to all of us in the food allergy community as being one of the most critical partners on the landscape. FARE recently published the results of a 2-year study that you all had done called the Food Allergy Consumer Journey. I think people are not often thinking about what it takes to be someone who buys for a food allergy family, or how much of an impact food allergy consumers and shoppers have on the market. So I would love to know, what are some of the key findings that you all turned up in this study?
Well, thank you very much. And thanks so much for having me. And congratulations to Emily. Emily was a visionary before her time. And during COVID, what we know is the work that FEI is doing has really moved into the spotlight because it's so critically important. So I just thank you for the partnership and for everything that you all bring to this. As Karen mentioned, we released in early May the Food Allergy Consumer Journey, which was a 3-part series that was comprised of 3 different studies, one by Northwestern on precautionary allergen labeling, McKinsey, really looking at what a food allergy family's steps are and decision-making process when they're making a purchase. And then we talked to Global Strategies Group, who looked at the lives of individuals who are on WIC and SNAP, those in the underserved community. And what we learned through this is a couple of things. One is 85 million people, 1 in every 4 Americans, actually avoid buying food with the same 9 top proteins. So the allergens are actually avoided by 85 million Americans. And where that breaks down is you've got 29 million Americans who have 1 or more of the top 9 life-threatening food allergies, 31 million Americans who have food intolerances that are quite significant. And then you've got 25 million Americans who avoid buying the food because they live with someone or they're working with someone who has a food allergy. And so what that means is that this is a really big voice. This takes our voice of the patient, knowledge of the changes that we can help get regulators and industry and key influencers to make, because all of a sudden we're stepping forward with a very large army of people. And the critical thing about this army of people is that trust is the most important thing to all of you who are watching today. We know that. Safety takes precedence above taste, value, and convenience. Taste, value, and convenience is normally how consumer packaged goods companies talk about the food that they're providing. But what we've explained to them as safety is foremost the most important thing. Another is that you're very loyal shoppers. And we know that food labels are probably the number 1 place where you develop that trust relationship. And right now there are 40 different labels in market and they have no meaning. And so you're stuck reading a food label 5 to 10 minutes, which for all of you who are really busy and you've got your kids with you or whatever you're doing, that's not appropriate. And so we're very excited that this research really brings the information to bear in a manner that we've been able to get a lot of attention working with Emily and a number of our other collaborators on making sure that food company CEOs are sitting up and all of a sudden going, yeah, we've got to work on this topic.
I mean, food allergy labeling, it's, a huge issue, obviously, for, those of us who are used to doing that kind of shopping. In terms of pursuing what it sounds like, one of the main initiatives here is to get, a universal kind of labeling, if you will, something with a format, a standard that is easily understood. How do we get, even once we get to the point of getting a label like that, how do we educate people as to, how to use it and what it means? I mean, it sounds like there's another component behind this, just beyond even getting industry to cooperate on that.
Absolutely. So FAIR's been pushing and working with our collaborators and pushing for one standardized label, one mechanism of communication that can be easily understood, not just by the 85 million people impacted by the disease, but by 330 million Americans who are going to be having slumber parties and sports teams over. And so what that means is that we want to standardize the information and standardize on one label that's on the package, but not only on the package, it's part of the QR code. So if you scan something, it's always the same. If you call an 800 number, you're told exactly the same thing, no matter which brand that you're calling. And most importantly, with the acceleration of online shopping, 1 out of every 5 shoppers, that's a place where we can make those changes very, very quickly. But Karen points out something that's critical, and it's one reason we have to partner with industry, is that in the past, there have been other initiatives. There have been 2 other initiatives that have been quite successful. One is front of pack labeling. When you look at your Lay's potato chips and you see up top, the calories and the sodium, et cetera, as well as what we call the sell by or use by date. And the reason those were successful is that the industry funded a national campaign so that everyone who was reading that package or going into a QR code understood what that label meant to them. And that's really what we need. We will only be able to reach as our own communities, but we have to go beyond our community. And the industry actually does have a touch point with every single person who purchases food in the United States. So we need their support because we actually need to use their megaphone, their channels, their touch points, so that you as a parent are never scared when your kid goes to someone else's house or they've got an overnight away trip someplace, that the people who are with your child have the same understanding of the label as you do.
So thank you for laying that out, Lisa, because again, behind all of these efforts, institutional change, it sounds like on many levels begins with educating people, as to why this is so critical, as opposed to, folks just being picky about what they might want to hear. But, that they need an actual understanding of why this is important. So definitely this is something we'll touch on again. I want to go ahead, thank you, Lisa, and turn to Nicole. Nicole, thinking about the whole issue of safe ingredients, access, one of the things that I think got you all on the radar at 88 Acres of food allergy consumers is, not just the delicious products, the seed-based granola bars, the butters, the things that you make, but the fact that you have taken a really interesting step in developing your market to include schools. So it's a big thing to step into the world of school lunch program and, local, regionals, federal health regulations. It's very big for a small company like yours. Why did you decide to take that step?
Thank you so much for including us in this very important discussion. And I'm thrilled to be here. So thanks for having me. We really wanted to start working with schools because we started to hear from a lot of our consumers this issue about access. One of our first channel partners was Whole Foods, and they have been they've been an amazing partner. When you walk into a store, obviously there's people who are the people who work at the stores are helping to educate consumers on all kinds of different food issues. They obviously have worked really hard to be an advocate for certain food issues. But we realized that through our retail strategy that we were not reaching enough consumers who needed our product. And schools were an area that we thought that we could really make an impact. I definitely fall into that third bucket that Lisa was talking about, where I live with someone who has food allergies. My husband is deathly allergic to peanuts and tree nuts. We have a 4.5-year-old son who's deathly allergic to sesame and tree nuts. Being a mom, sending a child into school every day, that's where we really thought that we could make an impact. I think one of the most important things that we have really been zeroing in on is trying to bring the discussion around to, we don't want to make food, we don't make allergy specific food and hope that it tastes good. We make delicious, nutritious food that happens to be safe for anyone who has a top 9 food allergy. But the conversation with schools is that this is not just a solution for the children who might have an allergy. This is a solution for your entire community. And it's really about the care that goes into the manufacturing of the foods, the care that goes into the supply chain, bringing the highest quality ingredients, and really bringing this transparency and education around the ingredients in the food into the food community. And so the schools that we've been able to partner with, really focusing in on that kind of like the education around, we should be looking at the ingredient labels and understanding exactly what is going into our bodies, and bringing that conversation all the way back to the field. So we use seeds as our number one protein source, and doing things like planting gardens with school children, and seeing that sort of aha moment of planting a pumpkin in the springtime, harvesting it in the fall, cracking that open and being able to use that ingredient and understand where it comes from. We feel like, affecting that change and that food awareness at an early age really sets people up for healthier eating habits later in life, and the ability to affect change within schools really was, we could maximize the impact across the consumers.
So that's a wonderful step, because obviously for many people who are food allergy consumers, your kids are the gateway into this market. And, if you're creating something that is an inclusive product, it also means that those kids are not getting singled out in the classroom as the kid who has to eat the different thing, and that everyone has the same food and everyone can enjoy it in the same way. So in getting to that point, kids are notoriously picky consumers. How did you manage to make what some people might see as a niche product, the kind of thing you can only get at a Whole Foods, and that might look to someone, a little bit more exotic than what they're usually seeing? How did you manage to make that appealing to kids and then also satisfy the really specific requirements of the federal food program?
So we spend a lot of time doing things like taste testing, gathering feedback. Kids are very honest about what they like and what they don't like. And so, for example, we make a pumpkin seed butter. It's bright green because pumpkin seeds are green when they're taken out of their shell. And the way that we talk about foods, almost in like a green eggs and ham type of way, what we found was that kids, the more involved they can be in their food decisions, and in why something might be green or why something might taste the way that it does, the more excited that they get. And so when we were literally in schools making pumpkin seed butter and jelly sandwiches, using pumpkin seed butter to make like a salad dressing, and then kind of gathering that feedback, tweaking it. We did the same with bars. First and foremost, things have to taste good to get the kids behind everything. And I might think that, buckwheat is the greatest ingredient in the world, but if the kids aren't going to eat it, then it doesn't matter if we're bringing that to the table for them. And so really pairing that, trying to make the education around different ingredients fun and interactive. So when we were sampling our bars, we had these little cards and they had seed fun facts on them. So we learned that millet is considered a grain, but it's actually botanically a seed, and just some kind of like almost like trivia questions for them that got them involved in the conversation. And they got excited about these ingredients. And, I think that like when they have a voice, you can see the levels of participation within the schools that have, that incorporate the children's voice into the food choices, that we've seen that the participation levels are higher.
One thing that I think is, you know, from having read a bit about the company and spoken with you, that comes through in all of this is that there is a real commitment to community involvement in developing the products that you end up bringing to the school districts, and that in having that community involvement, people also have a voice from a cultural perspective in terms of what we like and what we don't like. And that is, again, a big commitment of time and effort on your part. So that is something that would be very interesting, I think, for other companies to look at in terms of how they choose to develop products that might be marketed in this way to families. So I would love to move on. Thank you, Nicole. And Jerry, step over and talk to you for a moment. You represent a major healthcare organization that has a very big presence in your community in Kansas City. And when we're talking about things like expanding access to food, you know, healthy food options, and looking at food as medicine, you know, for food allergy families, where does an organization like a major insurance provider like Blue Cross Blue Shield fit into the equation?
Well, first of all, like you, Nicole, I'm really glad to be invited to be a part of this conversation and to be a part of this group. Where Blue KC, where we could potentially see ourselves, is being a part of the drive to cultivating a culture of equity within our community. And so we recognize that in order for us to do that in our community, that we have to first create and cultivate a culture of equity within our own organization. And so when we think about how might we best do that, and thinking about how we as a company interact with the community, the first place that it really starts is with that insurance card that our members have with them. And so as we begin to really dig into the fact that 80% of what is dictating our members' health has nothing to do with the insurance card that they have with them, we really had to start digging into figuring out, well, what might be driving health outcomes and what can we do about it? And so as it relates to food as medicine, I think many conversations with Emily and others really got us thinking about, well, what might it look like to begin covering non-clinical benefits? But being an insurance company, for us, one of our first steps is to actually begin the process of quantifying, like, what is the need out there? So one of the things that I think one of our places as community health within this insurance company is to begin asking different questions of data, and actually beginning to request sets of data that perhaps we hadn't thought to collect or even pay attention to. And so working with clinical partners, really helping them understand what's going on with their members or their patients, what are the things that they might be challenged with that aren't clinical in nature, and then figuring out how do we help people get connected to an FEI or to other groups that might be able to help them with their food needs. And by understanding what our members are experiencing as it relates to the lack of access and equitable access to food, and also what our clinical partners are experiencing in trying to assist their patients in making those connections, we feel like my hope is that the data tells us, the quantitative data tells us what we know anecdotally, is that food is medicine, food is prevention, and that we can begin to move toward the future where food is a covered benefit. That's certainly on our roadmap as a community health team within Blue KC. And we're hopeful that, in the very near future, we'll be able to say, yes, this is something that we look to cover as a benefit, because we just know, for many of our members, it is a life issue to have access and equitable access to food.
I think everybody here would concur when I say that for many people who deal with the difficulty and the expense of acquiring, allergy-friendly, allergy-safe food, that is a mind-blowing concept, that you might be able to submit some of those expenses to, an insurance payer and have that reimbursed, because it's a huge, proportion of the food budget for many families whose limited resources often don't stretch to cover the safest possible foods. So, you know, it's very exciting to hear that that type of approach is on the landscape. One of the things I wanted to ask is, you know, in terms of the way that, you know, Blue KC operates, you all get a lot of your sort of, you know, clients into services and working with community health partners through something that's called a social needs referral network. And
Yes.
I would love it if you could explain to people how that process works so they understand how you get someone to an FEI or to another partner that could assist them so that they would know how to be able to advise other people to go about doing that.
Yeah. Yeah, so it's a really fascinating time. So one of the things that I'm sure, you know, Dr. Jones can attest to, that in this healthcare space that we're moving more towards what we call like a value-based care, moving away from fee-for-service more to value-based. And what has happened is that, you know, organizations like ours have put a lot of expectations on our clinical partners to really treat the health of the entire population. And a part of that responsibility has been looking at how, you know, social needs are addressed, things that are not clinical in nature. And the company recognized that we are asking a lot of our clinical partners, and we haven't really provided a whole lot of support for them to do that. So essentially how it works is, for one, the organization has, starting in 2020, began to incentivize our clinical partners to actually screen for unmet social needs or the social determinants of health. And what we're doing is we're collecting those ICD-10 codes that tell us what's going on. Is it food insecurity, housing instability? Are there issues with safety in the home? Are there transportation issues? But we wanted to go beyond just understanding what's going on with our members, but we wanted to provide a platform by which our clinical partners could connect our members and all of their patients to organizations like FEI, or for whatever their specific unmet social needs are. And so what happens is that they're screened within a clinical setting. If they screen positive for an unmet social need, so in this case, if there's a food insecurity, and they also request assistance in connecting with the resource, then we go through our platform and we look for sources that are available. If they have a food allergy or a food sensitivity, they're able to get referred electronically through the platform to FEI, and FEI receives that referral. And so it's really a warm handoff. And there's the expectation on FEI side that they will be waiting for that patient to do outreach. So instead of us in the past, we may have provided an outreach, like an outreach guide. Like, here are organizations that you can reach out to in the event you have a member that has an unmet social need. And now we're connecting with actual people on the back end who are waiting and prepared to assist. And we feel like ultimately it will be a game changer, not only for the individuals who are referred, but our hope is that as we're able to begin to quantify both the demand and the capacity, that we can begin to, for other social agencies, just like what FEI is doing now, to really begin to transform itself into a kind of a value-based partner as a social care delivery agency, in the same way that we partner with a clinical partner. So we think that over time, this electronic referral process and being able to quantify both demand and capacity, and to demonstrate that needs are being met, we ultimately feel like we can begin to transform how we as health insurers view and partner with the social care sector.
Oh, that is so exciting. Just the idea that direct pathways could be established essentially almost from that point of intake for people to get to services that are often thought of as social services rather than things that are medically prescribed. So I want to hop off and get Dr. Jones into the conversation, but it does seem like this would be a good time to define for people who aren't familiar with the phrase social determinants of health. You referred to them very succinctly as unmet social needs. To sort of spell out a little bit more about what that is, that would include factors like your socioeconomic status, education, neighborhood, physical environment, employment, and your social support networks, in addition to your access to healthcare, because we know that all of those factors have a very, very big impact on the kind of care and the kind of security you enjoy for your family. So Dr. Jones, to bring you into all of this, this landscape, we're seeing is incredibly challenging for people to navigate. In many cases, families who come to the food allergy table come as the result of a very abrupt diagnosis that starts in the ER. How well is our current medical environment handling families with new food allergy diagnoses? I mean, what does this process look like when they're seen at an ER or a clinic?
Yeah, so thank you for having me. Like the rest of the panelists have mentioned, I'm very happy to be here, and also want to congratulate Emily and FEI on the important announcement today, because I think, part of my answer to this question really relates to the fact that, managing food allergy is more than just providing safe foods to the family. There's a cadre of support that these families need. And so what it currently looks like in the medical setting does not currently meet the needs of all of our patients. So typically what happens, if a patient is diagnosed with food allergy, for example, if I see a patient in my clinic and I confirm that, the reaction they're reporting, and based on testing that patient does have food allergy, that's a huge diagnosis for that family to take in a relatively short amount of time. So they're taking in a diagnosis at that visit that's really changing their entire world. And so during that 30 to 45 minutes that I have with that family, we have to make sure that, they leave with some knowledge of what the diagnosis is and how to manage that outside when they leave. And I think that's really the significant gap that we have currently in how we're able to manage food allergy, especially for families that walk into our clinic and they are already struggling with food insecurity. And then I tell them that they cannot have, their child cannot have a major food group. And, in my experience, I can see it on their faces a lot of times when I give them that diagnosis, and I hand them a packet of materials, a thick packet of materials to read, and that lists all of these different food groups and foods that they cannot eat. I can see their faces glaze over, and we try to give them as much information as we can at that setting. But that may not be the opportune time either to try to educate families on all of the myriads of food allergy management. But unfortunately, that's how our current medical system is set up. And so when I hear Jerry talk about the fact that there could be potential for covering and for supporting those infrastructures to address the social determinants that these families are having to deal with, I think that's really kind of a big missing link in how we're able to manage food allergies, because we're not able to provide everything that the families need in that 30 to 45 minute time period with just handing them a list of foods to avoid and an EpiPen prescription. I mean, the impact that the food allergy has on that family's entire lifestyle is way more than that, from the psychological component of managing a food allergy for the child and for the family, and having access to foods, and also being able to have the luxury of the education about food allergy. I mean, for some families who are managing multiple social determinants at one time, it's a luxury to be able to read about and learn about and know about and have the time to really understand food allergy and really implement practices in your day-to-day life to keep your children safe. So that's a huge gap in our current medical care that we are not doing a good job at.
So given all of that, I mean, and that's a huge component, the idea that when you receive this kind of diagnosis, it upends your entire family life. It's an emotional loss in addition to being a significant financial and just day-to-day living challenge. How could physicians, working in, hospital settings, clinic settings, how could they be trained differently, or how could they be, given, really a kind of idea of how to support families better in getting them into this process and making sure that they're connected to the kind of support that they need?
I think it's really about, from as an allergy specialist and pediatricians and other physicians that treat food allergy, I think many people do understand the importance of the educational piece. I think the piece that's often missing is understanding a lot of the social barriers that prevent families from implementing the recommendations that you make. So I think from a physician and clinician perspective, there needs to be more awareness about the true barriers that our families face that come into our clinics. I think many times we make assumptions on a one-on-one basis when we see our patients of who they are and kind of what their lifestyle is and what their needs are. But there really needs to be a more systematic process of identifying social barriers and social needs for all families, and making sure that clinicians are aware of that when they're practicing. The other aspect of it, I think, is not so much as education of clinicians, but providing clinicians the time and the infrastructure to actually do those elements that we know are so important for good outcomes in these patients and decreasing risk of life-threatening reactions in these patients. As I mentioned, when we see patients in our clinic, we typically have 30 to 45 minutes for that visit. And so, in making a food allergy diagnosis, you have very little time left to do the counseling and the educational pieces that are needed, and before it's time for you to move on to your next patient. So I think clinicians are really important in that, but there's also, I think, other avenues that we can look at in using community health workers with it, to contact families and be able to provide that support after they leave the visit. Because as I mentioned, when they first get that initial shock of the food allergy diagnosis, that may not be the best time to give them a lot of information and really walk them through how they're going to manage this on a day-to-day basis. So that would likely be better done by a community health worker or some other type of healthcare worker that can, meet the family in a comfortable space at a time when they've had time to absorb the information, and that they can help them walk through and develop a plan.
No, that's an amazing observation. Just the idea that, again, if you are in that moment of real, just emotional upheaval upon receiving a diagnosis and trying to absorb the medical information, it's a very, very difficult time to then start gathering all of the other factors that you would need to figure out exactly whether or not the family can afford to follow through on the things that they're being, charged with. And so having a follow-up from the community end seems really integral to a successful outcome. And so all of these roads seem to lead us back to community, no matter which way you slice it. And one thing I'd like to do, I think I'd like to open this conversation up now to questions from the audience. We're already aware of a few things that have popped up. Emily, if you see anything in the chat that, particularly, speaks to what you're hearing discussed here, please let us know. But sort of moving along on that path, talking about research, for example, which is an area where, folks are also looking for being able to get more of that data that, Jerry is talking about, that you've mentioned, to be able to assist families. F.A.R.E has found data on the, sort of front of the consumer end, but we're looking very much to see more research in the medical area. What kind of impact does the way that these kind of studies are designed have on the information that we get from that institutional perspective? Dr. Jones, I know you would have some thoughts on that.
Yeah, I think, our current research infrastructures in general do not allow us to understand how conditions and diseases in general impact our communities broadly. So in the current research environment, for clinical and translational research, research often focus on, or conclusions are often most able to be made on majority populations within our community. And so across all different types of research, there's a lack of inclusion of certain communities in those research arenas. For example, in clinical trials, it's known that the majority of clinical trials, those participants that are included are the majority white. And so African American or Black participants, Hispanic participants are often underrepresented or not represented in most clinical trials. We see that today with kind of the headlines with the COVID vaccines that are being evaluated in having difficulty in enrolling Black and Brown participants. And so, and this also impacts, what we have seen with the trials that have been conducted with food allergy interventions. There is a lack of inclusion. And there are, historical, significantly impacting the historical things that have occurred that have led to some of the lack of inclusion that we see. But it's really, the onus is really put on the industry and the investigators and the researchers to make sure that their research is inclusive and that their research can include conclusions can be applied to our general population, and especially be applied to populations that we know are highly impacted by certain conditions like food allergy and have increased morbidity and mortality in those populations. And so I think, there's now, I think, more of awareness about the lack of inclusion in clinical and translational research. And so the next question is, as we move forward, how can we better ensure that the trials that we conduct are equitable?
It's a great question, and I would wonder, for example, Lisa, F.A.R.E funds an enormous amount of research. You all are the leading funder of food allergy research in this country, perhaps in the world. What kind of role is there for, organizations that fund this research to support the goals of making sure that that research is inclusive and that it gets us the information we need to have people treated effectively?
Well, I'm glad you asked the question because it's something under the leadership of Anita Roach, who's Vice President of Voice of Patient and Education, along with Dominique Rodriguez-Sawyer, who's our Chief People Officer, really leaning into right now, working very closely with Ruchi Gupta. I should mention that during the March, April, May timeframe, we interviewed about 60 Black leaders around the country from a wide variety of different areas. And we kept trying to hone in, what are the biggest barriers? If we can do 3 things really well, what can we do in order to move the needle and ensure that we are able to create trust and then bring more people in a manner that works for the patient and also takes into consideration the social determinants of health. And I even take those down to the granular level. If someone is having to take time off work and they don't have a job, they have an hourly job, what's the impact on them? If they have to find somebody to take care of their children, they have to take 2 buses to get there, what are all the issues that we need to consider? And so F.A.R.E will be announcing over the next couple of months some major initiatives. One is that with a lot of guidance from the Alzheimer's community that was just featured in the Wall Street Journal, who's been one of our mentors in this, is how we develop community programs that become prototypes that not only work for F.A.R.E, but also work across the United States. And so we'll be announcing a relationship in one community where we're going in and developing relationships with the people that the community trusts. Another is making sure that the patient sees someone who looks like them. And we know that the majority of food allergy doctors are Caucasian, And there's not a lot of diversity. We have Dr. Jones, we have Dr. Carla Hill in Texas, but we don't have a lot of diversity. So where can we invest to make sure that individuals, leaders in public health and in medicine are brought forward to be that partner and actually have a greater understanding and look like the patient, because the patient needs to have someone that they truly fundamentally believe they can trust. And so we'll be rolling out some programs in that area where we're actually recruiting people from public health, from medicine, to go into our FAIR clinical networks that have the highest numbers of African-American patients within them. And so the other piece is, how do we incentivize innovation? The therapy, it doesn't matter how low you bring that price down, if the patient can't incorporate it into their life, they can't use the therapy. And so as we look at therapies moving forward, we'll look at safety and efficacy, but we're going to talk about things like usability. How easy is that therapy for a patient to actually incorporate into their day-to-day experience? And how easy is it for them to participate in a clinical trial? And what do we need to do to build the systems around the patient to enable them to participate in the clinical trial? So a big thank you to all of our partners who are watching today, to the Alzheimer's foundations who've been giving us guidance because they've tackled this area. But yeah, those are areas where we will be unveiling a lot of activity and are working on it right now.
No, it's very exciting to hear about all of those developments. The whole idea that people understand that this is, again, not just a medical issue, but an issue of how people live their lives, and that those social determinants of health can, either be, addressed to maximize the value of the care and support that people receive. If they are ignored, it almost doesn't matter what's out there if they can't access it in a way that's meaningful. One thing that I wanted to just throw to Nicole, there's been a lot of talk about this issue of, how we approach in a community fashion. And one of the things that is a real feature of how 88 Acres works is the idea that, community is the basis of your workforce, as well as your approach to the people who might consume your product. And I'd love it if you'd share a little bit about how you assemble your workforce and what that actually means in terms of your mission.
Sure. Community from every standpoint is literally the foundation of the brand. Going back to everyone's point on building trust within with consumers, we knew very early on that it was critical for us to be completely vertically integrated, to own our own manufacturing, to control our supply chain. And so we had a choice when we were thinking about what did we want that manufacturing piece of the business to look like, that we could use the manufacturing facility as a vehicle to continue to drive community. And so we built our bakery in like an economic development zone within Boston's inner city. Our first bakery hire actually lived next door to the bakery, and we really dug into our local community around us for hiring, and thought about who we wanted to be as a company, and really all of that started at the bakery. And so aside from providing local jobs, we wanted to provide jobs that were paying living wages. So we use MIT's living wage calculator, which actually starts at the zip code level. And that's how we base our minimum wage within the bakery. And we've hired by referral only for pretty much every hire within the bakery. A very large percentage, somewhere around 80% of our team lives within, within the same 3 zip codes. Many of them can walk to work. And it's, we're a family business in all sense of the word. So even within the bakery, we have multiple generations of a family who are working with us. And it's the the more we can drive this sense of community into every aspect of our business, it plays out in higher quality products that we can provide, more impact we can have in our immediate community. And so it really, like, we've seen it really come full circle, and it's a story that we don't always get to tell, but that we're super proud of. Yeah, so.
Thank you. I think, you know, it's, again, you have the virtue of being, you know, a small company, but you're making some very concrete choices. And the idea that you choose to very consciously look at ways that you can include the local community in, you know, building the success of your product, it also builds the success of the community. And I think that's a great lesson for others to, you know, always keep in mind. You can, you know, very easily do good while you do well. Emily, I think there were a couple of questions in the chat. Was there something you wanted to throw out?
Yeah, so we have a couple of questions. I think this is geared toward Lisa around labeling. So Anne asks, so is universal labeling going to push the food industry into establishing thresholds for food allergies?
Yeah, I saw that pop up and I really appreciate the question. That's a complex question. It's got a complex answer. So just forewarning, everyone is extremely interested in thresholds, even folks within the FDA. And as we all know, with the oral food challenge as our only mechanism for understanding someone's severity to a food allergy, that data doesn't exist. What's been going on is there's been a heavy investment in trying to figure out the threshold for peanut and some of the other allergens. And so what we're in conversations with is how do we have a rolling process so that people know that as new information comes forward, we can adapt that information. I think you'll see that there might be threshold information available that's fairly precise in maybe 1 or 2 allergens. What we're doing is we're going to be investing in biomarker research. It's one place we want the food industry to step in with us so that we can then have a validation point. There's some other mechanisms that exist out there with something called VITAL, where they can evaluate whether or not there are allergens within the manufacturing process. So the answer to your question is, it is absolutely part of the discussions. Technologically and scientifically, we're not there quite yet, except possibly on peanut, but we are looking at big data, gathering information, seeing if there's a way for us to pull information from clinical trials and from treatment centers. We're trying to see what information is out there so we can, and there where FAIR and our partners need to invest so we can accelerate that process so that you can have my answer in a year be, yes, it's absolutely happening.
Okay, we have one other question from Michael. What are some of the barriers that need to be addressed to get industry on board in robust, consistent labeling standards? So Lisa, one more for you.
They are on board right now. And what we're doing is we're working through a process with them to understand how it's going to work. It's not going to happen overnight. And everybody needs to understand that. It took front of pack labeling 5 years to happen. And I was part of that process. I think we're much further ahead because that was the first thing they'd ever done like that. And this one's going to enable us to move forward more quickly. We're going to be in conversations about where can we make changes in the digital environment as soon as possible. That is really where you want to see the change happen immediately because it takes a couple of years to move on to pack consistently. So lots of conversations taking place. And the question I'm actually asking is, what's the timeline? What are the steps? What do we have to do within this process to move it forward? But we're getting a lot of support.
I would love to jump in here. I'm just letting everybody know we're coming up on 12 o'clock. I don't know how much flexibility we have to spill over, Emily, but there is one question that, had bubbled up. Jerry, I'm going to direct it to you, but I'm going to ask everybody to jump in with whatever thoughts that you might have. How can institutions like yours, whether they are, healthcare, delivery groups, if we are, talking about, the medical environment, vendors like Nicole, how can we create opportunities for feedback and partnership with underserved communities, specifically communities that have been excluded, on the basis of race, to ensure that the outcomes that we've all discussed today actually align with the community's needs and values? What do we need to be thinking about from each of our respective positions about how to make that possible?
I think that's an excellent Excellent question. And so that's part of that. That is part and parcel of the work of community health, is really figuring out from the organization's perspective, like how might we actually become part of the community. And from my side of the work, it very much looks like direct engagement and listening. So we are going to really rely on a lot of our partners within our referral network to really begin to help us connect with community and just begin that process of kind of working our way down to really being down at the grassroots level. I think we're also going to be relying on a lot of our clinical partners who also have their own community advisory groups, really looking at ways on how we might begin to connect with individuals at the neighborhood level, organizations at the neighborhood level. But I would say that for those who are at the community level or who are interested in trying to figure out how to connect with a Blue Cross and Blue Shield, or I should say even vice versa, how an organization like Blue Cross and Blue Shield connect with folks at the community level, I would say that from an organization like Blue Cross, there has to be an interest and a desire to be a part of community and integrated in it. And it has to be a willingness on an organization's part to hear the truth, the unvarnished truth, and to embrace it and accept it. And so we're taking those steps now to do that. But I think it has to come from the organization side to be willing to be a part of community and to be a part of the actual process, which doesn't work, and really neat Gantt charts. That it really will take an adjustment on our side, and that's the work of our team, is to really reimagine how we want to be in relationship with the community.
Oh, I love that. It all begins with you.
Yep, that's right.
Basically.
Yep.
Other thoughts, Dr. Jones?
Yeah, I couldn't agree more with Jerry's comments. And also, I was really excited to hear Lisa describe FARE's plans of how they're going to move forward in conducting research with communities and with community partnership. Because, I think that, from a community's perspective, it's really important to engage them during the entire part of the journey and really learn from the community what their needs are, what is meaningful for them, and what are the challenges that they are experiencing. It's really difficult to develop an intervention or a strategy or a program first and then go into the community and tell the community, hey, how can we make this now culturally appropriate? You really have to have that conversation all along. And you really have to establish those partnerships and trust with community before you even start thinking about your programs and your interventions, because the community has to trust you first. So, as Lisa described, the labeling changes that are kind of in the pipeline and how this is a long journey. It's also a long-term investment for organizations to invest in communities and be in communities so that they can develop trusted partnerships. So down the line, it may be 5 or 10 years from now that you may have a program or an intervention that you want to develop with a community, but you've established that trusted partnership. And that's an investment in time and resources that organizations have to be willing to make, that immediately you may not have a financial payoff that you're looking for, but it's really important to establish that up front so that you can be successful down the line.
No, that's, that's, absolutely huge. The idea that, both you and Lisa have pointed out very clearly, and Jerry did as well, this is a long road, but that the investment has to not only be declared, but then sustained over the time period necessary to make change. And, we're very much in that mind frame of making change after the year that we've all been through and are still going through. And I think there is an understanding now, perhaps even in a way that there wasn't before, that, change requires commitment on a different level. And so I'm excited to hear about all of the developments that everybody has put forward today, because those are all things that push us in the direction of being able to support families more effectively and make sure that they're getting the care and, frankly, the love that they need from their community institutions. Um, Emily, I think I would ask you, we talked about, the idea of food being medicine really is a community concept as well. What other models are there out there to promote this concept and to get it in front of as many people as possible? It's not all on, insurance payers like, Jerry. How else are people educating folks to get them to the table on this concept?
Yeah, I mean, I think food is extremely powerful, and I think it definitely has the ability to transform communities and to cultivate good. We've heard that as an example from Nicole and the work that they're doing at 88 Acres and transforming their own community, democratizing free from foods in the school lunch program, and just creating access through a variety of channels of pipelines. And I think that, again, starts with community and making sure that, again, just as healthcare is transforming from volume-based to values care, that even in the social sector, that we also have work to do to make sure that what we do aligns with the values of the people that we serve, and that they are our reason for being. And so another kind of organization that I think is doing really great work in championing not only food as medicine, but really just the power of food, and that is the Good Food purchasing policy or program through the Center for Good Food. And, they have really taken that ability to focus on the power of, public dollars. So where are public dollars being spent on food, and how can we influence that for good food? So meaning good food that, that encourages health and wellness, that, pays a living wage everywhere along, the supply chain. So from farm workers to food service workers. And so we're thinking about those, like cities where there may be cafeterias or vending programs, and hospitals, hospital food, there's public dollars being spent on food there, and schools where these programs where the community is invested, and where those dollars really need to be counted for good in our community and can be transformative. So that's one organization. Again, I can't tell you how important food policy coalitions are. Many communities have them. We're actively engaged in our food policy coalition here in Kansas City. And I can't, food is so central to the lives of families impacted by food allergy. So we have to be actively engaged, not only in policy regarding the label, but all aspects of food policy, from the Farm Bill to the Child Nutrition Reauthorization. And so that's why I say, if you care for someone with food allergies, you need to be actively engaged in food policy.
And I think for anyone who is not aware of these organizations previously, please go ahead and take a look at the chat. The information is there for you to be able to visit online. There's a tremendous amount that we can do to educate ourselves and be effective partners within our own communities, because, in the end, all politics is local, all food starts as local. And in order to be able to improve the quality of life for people in our food allergy community, we need to know as much about the people who are serving it as possible. So this has been an amazing discussion. Thank you all so much. Sadly, the Zoom window will close very shortly, so we are out of time. The conversation, as always, will continue on social media. We hope that the ideas that we've shared with you today will inspire some new community efforts from all of you in the audience. So we'd like to thank all of our panelists, Lisa Gable, Dr. Bridgette Jones, Jerry Jones, and Nicole Ledoux. And a very, very special thank you to Emily Brown for bringing us all together, and to the Food Equality Initiative that has made this entire dialogue possible. We especially would like to thank all of the families out there living with food allergy. The work that we do together will create a safer, healthier, and happier life for everybody who is part of the community. Thank you for joining For the Health, a conversation on race and food allergy. We'll be taking a break for the next couple of months to work on some important projects, but we will look forward to gathering together again in the new year, and hope that everyone has a terrific fall. Enjoy your weekend. Thank you so much.